awareness of some of the workup and treatments that we have available that can really not only help on the fertility journey, but also identify other problems that could affect a man's health and well-being long term. And as partners work on their fertility journey, sometimes can even open up other avenues or options for them as they move forward on the path to pregnancy. So what is infertility? So we define infertility as if a couple is trying to have a baby for 12 months if the female partner is under 35, or 6 months if the partner is over 35. If they've been trying for those time periods and they have not had a successful pregnancy, that's what we define as infertility. If the female partner is over 40, that's a situation where we recommend seeking an immediate evaluation, because the last thing we want is to miss any opportunities to help couples sort of move forward on their fertility journey and again on the path to pregnancy. There's special considerations if female partners know that they have irregular periods, or if they have known issues with the uterus or with the fallopian tubes, and also within sort of my wheelhouse, if there's a known male factor issue, or if the male partner has been diagnosed with hormonal imbalances, or if they have specific issues in their medical history. Those are specific situations where an immediate evaluation would be warranted, outside of waiting for these specific time periods that help us with the definition of infertility. So an infertility diagnosis, once partners are experiencing infertility, figuring out what can be going on can lead us to answers within a lot of different categories of symptoms and diagnoses. So there can be a combination of factors in up to 30% of cases, which means we identify factors both on the male and the female side of things. In another 30%, we actually identify only male factors. And so if you combine all the numbers, realistically, 50% of cases of infertility, there is an identifiable male factor there. The remainder of the cases are a little bit more specific on the REI or reproductive endocrinology side of things, which is the OBGYN who you would see at Kindbody. But within the male side, 50% of the time, we can identify a male factor that could be a contributing factor to infertility. So factors to consider. When men go through puberty, that's when they actually start making sperm. And so whenever I see patients, if they're told that they have an abnormal semen analysis, sometimes they'll say, well, that week I wasn't feeling well, or that day I did this. Do you think that could be causing the problem? It actually takes us 3 months to make those sperm. So it takes 3 months for sperm to go through the maturation process and for it to actually become part of the semen. So when we look at a semen analysis, we're actually looking at the previous 3 months of time. So nothing you do the day of, short of, if most things you do like around the day of collecting a semen analysis won't really affect that result. It's actually looking at the previous 3 months. We do know that sperm quality can decline after the age of 50, and there can be sometimes some chromosomal issues and potentially some mental health issues that can develop in offspring of male parents over the age of 50. So that is an important part of the counseling for helping older men on their path to parenthood as well. As I mentioned, male factor infertility plays a role in about 50% of infertility cases. 20 to 30% of the time, it's just a male factor. And then another 30% of the time, it's a contributing factor to issues on both sides. Some of the testing that we have within male infertility includes a semen analysis, as I mentioned, which is an analysis of semen looking at the sperm cells in that fluid. So it tells us it gives us an idea of as far as what is the fertility potential of that patient at that time. Sometimes we can use urine analysis in specific situations. We can do blood testing to look at the level of different chemicals in the blood, which we call hormones. There's a special test that we can do called DNA fragmentation that is used in some situations. It's a type of semen test. We do infectious disease testing. And then in certain situations, we do specific genetic testing, looking at chromosomes and looking at the Y chromosome, which is sort of the male chromosome that has all the information that's needed to make sperm. So going back to the beginning again, looking at sperm and fertilization. So if you were to look at a semen analysis, you would notice that a semen analysis states that there's many, many millions of sperm in a sample. And the reason there are millions and millions of sperm in a semen sample and why we need so many of these sperm around for pregnancy to result is because once semen is deposited in the vaginal canal, the sperm cells in that semen actually have to travel through the cervix, through the uterus, up the fallopian tube, and then reach an egg to fertilize the egg and then create an embryo and lead to a pregnancy. So at each step of that process, we lose many, many millions of sperm. So of those many, many millions, ultimately only one sperm will reach the egg, fertilize the egg, and create that embryo, which can then implant and lead to a pregnancy. So the male fertility spectrum is sort of it's a kind of like a numbers game, because we need a certain number of sperm to make pregnancy more likely, because those sperm have to go through such a great journey to reach the egg, basically. So that's part of the evaluation, is determining fertility potential based on some of the data we have on how many sperm are required to make pregnancy likely. So when patients are referred, they then undergo sort of a male factor evaluation, where we determine, again, what are some of the factors that could be impacting their fertility, and we also determine their fertility potential. So that evaluation includes their history. We do a physical examination evaluating the testicles where the sperm is made to make sure that physically everything is normal. We do some laboratory evaluation. Again, like I said, we check hormones, which are chemicals in the blood. Occasionally, we can check some genetics. We always do a semen analysis, because that's probably the most important part of the evaluation, to determine, could there be a male factor that's a contributing factor to infertility? And then in some rare cases, we also do ultrasounds, which is basically a study where we can take pictures inside the scrotum using sound waves from outside the body. So the male factor evaluation history focuses on sort of 6 main things that give us a clue as far as, is there anything in a man's history that could be contributing to infertility? Obviously, we talk about their sexual history. So that includes any issues with erections or ejaculation that may make intercourse more challenging and then make a pregnancy more challenging. We talk about any history of sexually transmitted infections or issues with their sexual past. We talk about pregnancy history, both with their current partner and previous partners. We want to know if they've been able to conceive previously, or if this has been a lifelong factor. We want to know if they're on any current therapy for fertility, whether it's they've seen a urologist previously and they were started on medications, or if they've been diagnosed with low testosterone and had been put on testosterone replacement, which we'll talk about here in a couple of slides about how that impacts fertility. We want to know about childhood diseases, things like undescended testicles or hernias or any urologic conditions that could impact fertility. And we also want to know about their medical or surgical problems. So this includes things like diabetes or high blood pressure, or in some older gentlemen, enlarged prostates, and surgical things that they could have had done, including hernia repairs, or in some men, even vasectomies. So men who have had vasectomies who want to have kids afterward, there are options that we have to help them sort of pursue their fertility journey again. Finally, we talk about gonadotoxins. That's sort of a complicated term just for chemicals or substances that men can be exposed to that could impact either their hormone levels or the way the testicles are functioning to make sperm and testosterone. So we have lots of diverse causes of male infertility. The thing to keep in mind as men enter an evaluation is that in up to a third of patients, we actually won't find a specific reason. In those situations, what we focus on is sort of optimizing sperm production for them and helping them on whatever the next step is on their fertility journey, whether that could include what's called assisted reproductive technology, which includes things like, if you've heard of IVF or in vitro fertilization or IUI or intrauterine insemination, in those situations, we try to focus on what can we do to help support them on their journey through ART. In 15% of men, we find something called varicocele, which is essentially a dilated vein around the testicle. We'll go into that a little bit more in depth as we talk about treatment options, but this is a common finding within the fertility realm. We also frequently find hormone imbalances, which can include either low testosterone levels or low levels of chemicals that are made by the brain that control testicular function. So if we find hormone imbalances, sometimes we can offer medication management that can improve sperm production. And then in a low percentage of men, we can also find either a history or current presence of an undescended testicle. A low percentage of men may have a cancer diagnosis that we find. Some men may have sexual dysfunction, and a low percentage may actually have like a congenital blockage or obstruction that's been there since birth that we didn't know about until they were trying to have a baby, and then we did some testing and found that sperm counts were either very low or zero. Oh, go back one slide. There we go. Another reason so obviously with a male fertility evaluation, we definitely want to figure out what could be going on that could be impacting that man's experience, that man's fertility journey and how they're experiencing infertility. But another reason to undergo an evaluation is, as I mentioned at the beginning, finding out things that could potentially impact their health long term. So we know that men who have lower sperm counts or who are experiencing infertility due to reduced sperm production actually have a higher rate of cancer diagnosis. So sometimes when we see men who have low sperm counts and do a physical exam or do some testing, we can find things like pituitary tumors or sometimes even testicular tumors, which would require treatment. So the evaluation is not just to help them on their fertility journey, but also to make sure that there's not any health problems that could be going on that could potentially impact their long-term health or their longevity. So the evaluation and seeing a physician is not just to help them have a baby, but also to make sure that they're healthy for their life and also can continue to live as healthy parents in the future as they move down their fertility path. So when we get a semen analysis, again, this is usually the first test that we do for male fertility. When we look at a semen analysis, and we'll talk about what we see on that report, but the questions that you may have about a semen analysis are what's normal or average, and then how does that compare to what's needed for pregnancy? Because those are actually different numbers, and we'll explain why that is here on the next slide. So when you look at a semen analysis again is looking at the fluid that is released when a man experiences orgasm and ejaculation. So ejaculation describes the process of release of semen from the body during sexual activity. And a semen analysis is actually looking specifically at certain factors and different parameters to describe the semen. So that includes things like how much fluid there is or the volume. It includes different analyses of the sperm cells inside the semen. And then it also includes an analysis of different factors that affect the semen. So how thick it is, what the acid-base balance is there something called fructose in it? And the reason all this is important is because, yes, sperm cells and the way sperm cells move and how many sperm cells there are is important for fertility, but different factors that affect the semen can also impact fertility. So when we get a semen analysis and we get a report, it'll tell us specific lines that list these results. So it'll tell us what is the volume of the semen or how much fluid there is. Looking at the sperm cells, it will tell us how many sperm there are, and that's described as how many millions of sperm there are per milliliter of fluid. In looking at the sperm, it'll tell us what percentage of the sperm are moving, which is again given in a percentage. And then it also tells us what percentage of the sperm are shaped normally or the morphology rate of the sperm. And all these numbers sort of go into a report that we get. And then those numbers are used to give us calculated values that help us predict the fertility potential of a patient. These samples are collected by masturbation into a cup, usually collected by masturbation into a cup. And we recommend that men abstain from sexual activity for 2 to 5 days before giving a sample. So we make sure that we get an accurate picture of their fertility potential. There are specific situations where if there are religious objections to masturbation or if there are challenges to masturbation where we understand that semen analyses cannot be done with masturbation. So there are accommodations that we can make using either like a condom collection of semen if ejaculation can only occur during intercourse for that patient. So yes, it's usually collected during masturbation, but that should not be a hurdle to a man getting evaluated. So we do have accommodations that we can offer in those situations. So this is where we talk about what are the percentiles that are necessary for fertility versus what's normal on the report. So if you look at a semen analysis report, usually on the right side of the report will be normal ranges or like a minimum number for the value that's reported to be in the normal range. So if you look on this chart, everything in the 5th percentile column will be listed on a semen analysis report, which means that in order to be in the 5th percentile of men who have given a semen analysis, you have to have at least this value. So if you look on the second row on sperm concentration, the 5th percentile of sperm concentration is 16 million sperm per milliliter. However, if we look at the average or the 50th percentile, it's actually around 66 million per milliliter. Similarly, for total motility on the 4th line down, the 5th percentile is around 40%, but if we look at average, it's actually closer to 60 to 65%. And this is important because this actually, the numbers that are closer to average are probably what is usually needed to make pregnancy more likely and more successful. So if you get a report that says everything is normal, sometimes based on how those numbers combine to give us calculated values, even though the number may be normal, it may be on the lower end of normal. And if you have several numbers on the lower end of normal, some of the calculated values that we look at to predict fertility may actually be low. So couples who are experiencing infertility or men who are experiencing male factor infertility sometimes may have values that are in the normal range, but it still could be a value that represents a challenge for fertility. So a closer look at that, here we see, this is a chart that the black line represents men who successfully had pregnancies with their partners. The white bars next to it represent men who are having challenges conceiving with their partners. So you can see the highest percentage of men who were fertile or who had successful natural pregnancies actually had sperm concentrations above 48, between 48 million per milliliter and 100 million per milliliter. And then we see a higher rate of infertility when these concentrations were low. Which brings us to what happens if you get a semen analysis that comes back abnormal. How does the workup proceed? And then what are some of the treatment options we have? So an initial evaluation occurs. Oh, go back. Thank you. So an initial evaluation occurs at which with a semen analysis, and the patient is patient comes to us with a diagnosis of either low sperm counts or low motility or whatever abnormality we may find on the semen analysis in the setting of their fertility challenges. So at that point, the patient would then meet with someone like myself, who is a male fertility specialist, and we would then talk through all their history, talk about how long they've been trying to conceive and what their fertility journey has been like before, if they've had any previous testing. And then once we get their entire history, both medical and surgical, and talk about any testing they may have already had done, we would then order some additional diagnostics, some of the things that we talked about previously. Blood tests, we would do a physical exam. Oftentimes we recommend 2 semen analyses to confirm the findings of the first. And then once we do an exam and get these results back and review all the results, we come up with a treatment plan with our patient. And so treatments for male fertility typically fall into 3 main categories. Some of those can include lifestyle changes if we identify exposures that may be happening on a daily basis or in your daily life that could be impacting sperm production. Sometimes it involves medical management for some of those hormonal imbalances that we discussed. And then sometimes there are actually procedures or surgeries we can offer that can significantly improve sperm production. Or if a man presents with no sperm in the ejaculate, those procedures can sometimes involve sperm retrieval procedures, where we can sometimes find sperm if it's not present in the ejaculate. So one of the common procedures that we offer our patients is repair of something called a varicocele. As I mentioned, we find these in up to 15% of men who have male factor infertility. And what a varicocele is it's the word kind of sounds like varicose vein because that's what it is. It's basically a varicose vein that, instead of varicose veins that people commonly associate with veins of the legs, this is a varicose vein that occurs around the testicle. When you think about the testicles, obviously the testicle is present in the scrotum, and the reason, which is outside the body, and the reason the testicle is sitting in the scrotum outside the body is because it needs to be cooler than body temperature to function normally. So these large dilated veins that can exist around the testicle, one of the reasons we think they impact fertility is by raising the temperature of the testicle, which prevents it from functioning normally. So these are always diagnosed with a physical exam. So they can feel like either a bag of worms or a series of lumps or bumps, or sometimes it can feel like small tubes in the scrotum. But if you have an enlarged vein there and you have semen abnormalities, if we fix it, 70% of men can actually see a significant improvement on their semen analysis. So these are things that we commonly find on the evaluation of male fertility, and something that we definitely can fix. Which leads us to, so like I mentioned, 70% of men who have semen abnormalities can see a significant improvement here, but that leaves us with 30% of men who may not see a significant improvement on their semen analysis. So what do we think is happening there? So if you go to the next slide, we know that if men have a varicocele and we fix it, that fixing a varicocele, regardless of the change on a semen analysis, results in improved IVF outcomes. So while fixing a varicocele, like I said, 70% of the time can improve the semen analysis results, we know that it's also improving the quality of the sperm, because regardless of whether or not it improves semen, like sperm counts or sperm movement, we know that repairing those varicoceles improves IVF outcomes, which implies that we're improving the quality of the sperm, regardless of the count of the sperm or the motility of the sperm. Yes, frequently those parameters do improve when we fix varicoceles, but we also know that we're improving the quality of the sperm, which can lead to more successful pregnancy rates with IVF. And this is just some data supporting that statement. So we know that when you compare men who had varicoceles who were treated versus not treated, and they did something like IVF, clinical pregnancy rates among men who were treated was 60% compared to 45%. And then live birth rates occurred in 46% of those cases versus 31% of those who were not treated. And those were significant findings on the data, again, supporting that fixing a varicocele not only can improve sperm counts, but can improve sperm quality, which can help at any point on the fertility journey. So that's one of the major surgical treatments we can offer patients if we identify a varicocele on their evaluation. Now let's talk about some of the medical options we have. So testosterone supplementation is something that is widely discussed in the United States. And as I mentioned, we oftentimes find hormone imbalances or hormone abnormalities on evaluations when we see men for low sperm counts or problems with a semen analysis. However, if a man has low testosterone and is put on testosterone replacement, the common belief is that, oh, that must improve the way my testicles are working because I'm raising my testosterone levels, I'm improving sort of the male sex hormone in my body. Of course, that's going to help with my sperm counts. Actually, the opposite is true. So if a man has low testosterone levels and they're put on testosterone supplementation, oftentimes, let's go back. Oftentimes that can result in actually no sperm in ejaculate. So a man being diagnosed with low testosterone, being put on testosterone replacement therapy, the data shows that 75 to 80% of them within a matter of a few months, their sperm counts can go from either normal or low if they have fertility issues to 0. So it's important if a man is diagnosed with low testosterone and they're on a fertility journey, it's important for that patient to see a male fertility specialist. But it's also important for men who are diagnosed with male factor infertility and told they have low testosterone to make sure that they don't start testosterone replacement therapy. There are ways for us to support testosterone levels on a fertility journey in ways that are safe for sperm, which can help not only help men with symptomatic or symptoms that may be related to their low testosterone, but sometimes if a man has problems on his semen analysis and low testosterone, some of the medications we can use in that situation can not only help them feel better, but sometimes can also raise their sperm counts or improve the quality of the sperm they're making. So it's important if a couple is seeking fertility treatments or on a fertility journey, or even if they're just starting to try to have a baby, that if there is a diagnosis of low testosterone or a hormonal imbalance, that those men see a male fertility specialist, because if they were to go to a low testosterone clinic or be put on treatments for low testosterone, that includes things like injections or gels or whatever modality they use, that can have a significant impact on that fertility journey. So it's important you see someone who's a specialist in male fertility before starting medications while you're on your fertility journey. But within the male fertility evaluation, if we diagnose men who have fertility issues with low testosterone levels, sometimes managing those in ways that are safe for sperm can, again, not only help with symptoms related to low testosterone, but can help improve sperm counts and improve sperm quality too. Which brings us to our final category of things that can improve sperm production: lifestyle modifications. So not infrequently, especially in the United States, and sort of the Western lifestyle that we have, men who are diagnosed with male factor infertility, we may identify things in our visit with them that can be lifestyle factors that can affect the way you make sperm. So whenever I see patients, I always recommend that if they smoke or vape or use any type of tobacco products, that they eliminate those. And similarly, if they're using THC products or marijuana, that they eliminate those as well. There's a lot of evidence showing that there is a dose-based relationship to the impact these things have on sperm production, meaning the more you use, the more impact there is. So there's not been identified a safe level of smoking or tobacco use or THC use for sperm. With alcohol intake, it appears to be safe to have to sort of have a very low level of alcohol consumption during a fertility journey. It's always best to sort of abstain as much as possible, but I always tell my patients less than 3 to 5 drinks a week would be ideal. But if they can avoid drinking while we're on a fertility journey, that's always best. So managing some of these exposures that are part of our day-to-day life, sort of recreational use of substances that can impact fertility, impact the way we make sperm. Similarly, I always talk to my patients about fertility supplements. So there's only really been 6 main vitamins and minerals that have been proven to be potentially impactful in male fertility. Now, fertility supplements for men are something that I think is a good idea, just to, again, check all of our boxes and make sure we're doing everything we can to help support sperm production. But it's also something where I make sure that I educate my patients that I do not think that supplements are something that will make a dramatic change if we're dealing with true male factor infertility. It's something that is important to have, so we're supporting production, but I caution couples to think that supplements are gonna make a dramatic change, because usually they don't. What can make a dramatic change is maintaining or normalizing men's BMI or body mass index. There's a lot of evidence showing that if men are overweight, being overweight can have an impact not only on hormone levels, but on the way normal bodily functions work. So there have been many reproducible studies showing that if men are dealing with male factor infertility and they lower their BMI or lose some of the excess fat stores in the body, it can lead to significant improvements, both in terms of hormone levels, but also in terms of their sperm counts. Normal glycemic control for diabetic patients is very important for maintaining normal sperm counts and normal male fertility potential. And for all men, similar to the reasons like we discussed with varicoceles, they really need to avoid things like hot tubs, saunas, and steam rooms. The testicles, again, are in the scrotum because they need to be cooler than your body temperature. And if you're repeatedly exposing them to really hot water, like soaking in hot water or sitting in really hot and wet areas, the data really does suggest that this can have a dramatic impact on sperm production. This doesn't mean that if you work outside in the summer or if you sort of work in a job where your body is exposed to heat, that's going to have a big impact on your fertility. This is more for like hot tubs and saunas where it's a direct exposure to the testicles on heat. The main thing is, as we sort of wrap up talking about these treatment options, is that the fertility journey requires specialists for both male and female partners, but REIs, who are OBGYNs who specialize in female fertility, and reproductive urologists or urologists who specialize in male fertility work together as a team to help couples on this path. So it's important for both the male and the female partner to get tested and to both be participants in the journey, because like I mentioned, 30% of the time we do find factors on both sides. So it's important for us to be addressing both sides throughout the process as we work to help couples reach couples on their path to pregnancy. So sort of stepping back again, what can you do to sort of initiate your fertility evaluation? You can set up an initial consultation. So that initial consultation with fertility specialists could be either with or without a semen analysis that you've had done previously. We can schedule a semen analysis and then schedule a time to review your semen analysis with one of our male fertility team members. In reviewing semen analyses, it may not be with a physician if everything looks normal. Sometimes those visits are with some of our advanced practitioners who are also fertility specialists, but can talk about factors that can help optimize and maintain fertility if the results look normal. In those visits, we again review medical history and family planning goals and see what we can do to help support you on your fertility journey. But if you feel like you're experiencing infertility, or if you have questions about fertility before you even started a fertility journey, the first step would be reaching out and getting connected with our team to potentially set up a time to do some testing or have a conversation to see what we can do to support you on your path. And the main thing to keep in mind is, as we go through this fertility journey and treatment, even if we try treatments and they may not be as successful as we anticipate, we always have options. So there's always options that we have available. Our goal is to help couples as they sort of navigate these treatments to try to improve things. And then as we continue those treatments, talk about the options we have to help them lead to a pregnancy, and review all the options that are available with them, whether it's IUI or IVF, using donor material, whether it's an egg donor or a sperm donor, and sometimes even talking about the option for surrogacy or gestational carrier. So getting started, how do we get started with Kindbody? So the first step would be to visit kindbody.com to schedule. We're always available. You can go on the website 24 hours a day and start the process to setting up your evaluation. If you're wondering if your employer offers Kindbody, you can either reach out to your HR department or talk to your HR team and see if Kindbody is offered by your employer. If it's not, you can always reach out to your HR department and say, hey, what can we do to start this process to get Kindbody offered within our company? We also accept some of the most major insurance plans. And so it may be worth reaching out to your general medical insurance to see what fertility evaluations and treatments may be covered by your general medical insurance. So there are lots of ways that we can help sort of manage the financial impact of these evaluations and treatments. So if you have questions, you can reach out anytime. But again, the first step would be getting connected with our team to see what we can do to help support you on your journey.
Thank you so much, Dr. Pollard. That was very informative. We had some great questions come in throughout the presentation. We're going to take some time to answer those. I do apologize for anyone who put their questions in the Q&A. If you could drop them in the chat box. We're having some difficulties viewing those Q&As. We'll go ahead and get started here. Dr. Pollard, would sperm fragmentation or abnormal sperm yield euploid embryos?
Sperm fragmentation or emotions. So it can, so DNA fragmentation is a test that looks at what percent of the sperm may have breaks in the DNA. So that's usually a test that we reserve for very specific situations, whether it's an unsuccessful IVF cycle or recurrent pregnancy loss. So DNA fragmentation gives us a percentage. So the test will tell us what percentage of the sperm may have some component of fragmentation in the DNA, but that number is never 100%. So sperm from a patient who has some DNA fragmentation still can yield a normal embryo. Similarly, abnormally shaped sperm can still yield a euploid, like a normal embryo. So these factors, yes, they can affect IVF outcomes, and if we find these, if these are factors that we find on an evaluation, we always talk about ways that we can help support patients and support and reduce some of these factors. But yes, if these are present, they still can yield sort of normal IVF outcomes.
Thank you. For men over 50, is it possible to increase sperm that has already decreased?
So if you're concerned about it, there is some additional testing we can do. One would be, so when I said decrease, it's not necessarily that sperm counts decrease, it's that the quality of the sperm may be impacted. So we can do tests like DNA fragmentation. We can do hormonal tests to see if there's anything we can do to help support sperm production, but there's not a way to sort of reverse the clock. Those risk factors will be there regardless of what we do, but there are ways that we can help support the quality of sperm that you're making as you go forward on your fertility journey.
And next, how can men get tested for testosterone levels blood work?
Yes, so it's just an easy blood draw, either at Quest or LabCorp. Just a normal blood test. Usually the testosterone is best checked earlier in the morning. So I usually recommend before 10 a.m. for my patients, as it seems to be most accurate at that time.
Thank you. What supplements do you recommend to support male fertility? CoQ10 and fish oil.
So the 6 main ones would be vitamins A, C, and E, zinc, something called L-carnitine, and CoQ10. Fish oil is definitely great. I take fish oil, but there haven't been reproducible studies that showed fish oil to be a strong supplement for male fertility. I think it's very safe to take. It's not going to have any detrimental impact. And I think there are other reasons to take fish oil. So I still recommend it. But as far as male fertility goes, it's A, C, E, zinc, L-carnitine, and CoQ10.
Fantastic. Next question is, does cycling and riding on a bike seat affect fertility? Is there an amount of time for riding that makes a difference?
So there has only really been 1 or 2 studies that showed that, because there's a common belief that bike riding negatively impacts male fertility. One, there is evidence showing that bike riding can sometimes impact the nerves that help us with erections. So I think bike riding, like a lot of bike riding, can impact male sexual function. And the way to prevent that any negative impact would be making sure you have a seat that supports the pressure mostly being on the bone instead of sort of the area in between the legs, which is called the perineum. So you want to make sure you have a good seat and that it's fit and sized and the height is appropriate for your height and your body habitus. So I think having the correct seat is important for any impact on sexual function. But as far as bike riding on infertility, there was like I said, there was only 1 or 2 studies that showed a potential impact. I don't recommend patients cut out cycling with infertility diagnoses because I don't think that data is strong enough to say like you definitely should not cycle. I think if you're cycling, like a lot of the studies, one of the studies looked at sort of elite athletes, and so elite athletes in general may have different reasons for fertility issues, both for men and women. So there are different things that happen hormonally with athletes who are exercising not excessively and who are what we would call like elite athletes who that's their job and that's their lifestyle, which doesn't represent most of our patients. You can be really fit and you can be an avid writer, and I think that's that level of riding is very safe. The elite athlete column, which is what one of these studies looked at, is a very separate issue that I don't think reflects an issue with cycling.
Is there any research on the effect of Ozempic or Wegovy on sperm?
I'm sorry. Oh, was that one in? I'm trying to read as you're
I think I may have skipped a few. Yeah, so I just went done.
Sorry, I'm scrolling. So there hasn't been a lot of long-term data available on Ozempic or Wegovy on sperm parameters, but I will say for men who are dealing with obesity, that, like I mentioned, there is a lot of data showing positive impact with weight loss on sperm parameters. So I think we'll get some more information on the impact of these specific medications on sperm parameters. But if men are dealing with obesity and have low sperm counts, I think the weight loss component of it could potentially help improve things for them, separate than their use of Ozempic or Wegovy. So that data is still evolving, but I think for patients who are dealing with again, excess fat stores, eliminating some of those fat stores can help with hormone levels and also with sperm production.
Thank you. Can you talk about DNA fragmentation testing? Sperm analysis was normal, but highly abnormal DNA frag test results.
So DNA fragmentation is a process in which, so it's a test that when you do a semen analysis, it's looking at the sperm cell itself. But as we talked about, the purpose of the sperm cell is to reach an egg and then give the half of the DNA of the father to half the DNA of the mother, and then make an embryo or make a baby. So a semen analysis looks at the sperm cell, which is the vehicle for that DNA, but it doesn't give us information about the DNA inside of the sperm. DNA fragmentation testing looks at the DNA inside of the sperm. So DNA fragmentation is something that has been associated with recurrent miscarriages, whether it's with natural pregnancy or IVF, but it's also been associated with lower pregnancy rates after IVF. So it's something that we know occurs as sperm travels through the reproductive tract. So there are ways that we can address DNA fragmentation based on the studies. So those include sometimes more frequent ejaculation can reduce DNA fragmentation rates by eliminating some of the older sperm that's in the tract. If you're doing IVF, there are some of the selection tools that we have for sperm has been shown to reduce DNA fragmentation as well. And then if we try those things and still don't have success, we know that using sperm directly from the testicle, which is younger sperm that has not traveled through the reproductive tract, has much lower DNA fragmentation rates as well. So there's an option of using testicular sperm instead of ejaculated sperm for cycles in that situation.
Thank you. How long would you need to see if symptom management isn't helping resolve infertility, typically?
So any treatment that we start, it takes at least 3 months to see a difference. So, so if we were to start a medication, I tell patients we'll repeat blood tests after 4 weeks. And then after a total of 12 weeks, that's when we would do the first semen analysis. Similarly, if we were to fix a varicocele, I don't do a repeat semen analysis until 3 or 4 months after the procedure. So we give the body time to create a whole new population of sperm. Like we talked about, that takes 90 days. So the earliest time to do repeat testing would be 90 days, or it's 12 weeks.
Okay. Marijuana edibles affect male factor in any way during the process of trying to conceive?
So most of the, and I appreciate you asking that question. Most of the data on THC and marijuana and fertility revolves around people who reported smoking marijuana. Smoking can cause problems with infertility, problems with sperm because of many, many factors. So when you inhale smoke, it brings carcinogens and toxins into the body that travel through the bloodstream and go all over your body. So that certainly can play a role. There has not been strong evidence linking edibles to male factor infertility. That being said, if I have patients who are using THC edibles like very frequently or at a high concentration or a high dose or whatever it may be, I talk to them about, if we're trying to optimize things as much as possible, it may be worth trying to either reduce that or eliminate that just for a period of time to see if some of these changes in conjunction with some other treatments we have, to see if there could be an improvement on the semen analysis. And again, the goal is to see if the things that we do either improve an abnormal semen analysis to a point where either maybe natural conception is possible, or if we were initially talking about IVF, whether we could then move into the realm of IUI or open up other options for them. So in those situations, I just have a conversation with patients about like, yes, maybe the data doesn't say edibles are as bad as smoking, but if we're going to try a bunch of things to try to help with sperm counts, why not try making some lifestyle changes to see if that could also help?
Just in lieu of time, just going through the questions. Let's see. Any thoughts on stress levels with outcome of healthy sperm?
So stress is a little like studies on stress levels are challenging because stress is obviously it's a very subjective thing. And we think that stress can impact fertility in general because of the release of cortisol or the stress hormone and how that can impact testosterone levels and sperm counts and production in the male body. So stress levels definitely can have an impact on hormone levels, which subsequently can impact sperm production. So anecdotally, of course, all male fertility specialists have had patients who go through a very stressful period, whether it's physically stressful or emotionally stressful, and as things improve in their lives, potentially see improvements in semen parameters too. So it's the cause of it is probably related to release of separate stress hormones, which sometimes compete with our sex hormones. And then improvement is usually based on addressing some of those stressors and trying to help reduce stress in their daily life.
Thank you. There's some great questions. Let's see. If semen culture was done and bacteria was found in a sample, do antibiotics affect sperm? And how can the bacteria affect sperm quality?
So antibiotics typically do not negatively impact sperm. The antibiotic course is usually a little bit, if you find sperm, or if you find, hopefully we find sperm, but if you find bacteria in the semen, depending on the type of bacteria, it could either be a contaminant, because obviously when men ejaculate, that fluid travels through the tip of the penis, and if there happen to be bacteria there, which there almost always will be, and that bacteria were in a higher concentration, sometimes that bacteria could lead to a positive culture. So depending on the type of bacteria, a treatment may be indicated. The reason that if there truly is bacteria in the reproductive tract, the reason that that could potentially impact sperm quality is because the way the body fights bacteria is by releasing what are called white blood cells. And so white blood cells are basically like the body's defense system against bacteria. And the way that they attack bacteria is by releasing chemicals that damage bacteria. Theoretically, if those white blood cells are around the bacteria and the bacteria is around the sperm, if those white blood cells are there fighting bacteria, those chemicals could potentially also impact the sperm. And so if we find bacteria there associated with infertility, treating that can sometimes help things. And also, if a couple is pursuing IUI, sometimes we want to clear that bacteria from the sample so we don't inadvertently introduce bacteria into the uterus when we do IUI.
Thank you. All right, and then last question, any way to increase sperm motility?
So it depends on the evaluation. So if there are hormonal imbalances, sometimes improving testosterone levels can help support a higher quality of sperm production, which can include motility. Lifestyle changes can have a major impact on sperm motility. I mean, just today, I had a patient who went from very low motility to very normal motility just by making some lifestyle changes as far as exposures in his day-to-day life. And similarly, a varicocele could have a large impact as well. So if we fix varicoceles in the setting of low count or low motility, we can sometimes see dramatic improvements.
Thank you so much, everyone, for participating. Dr. Pollard, we really appreciate your time. Let's see, and anybody has any further questions, I'm actually going to drop my email right in the chat. Feel free to reach out to me. We think
I hope everyone has a wonderful weekend. Thank you for
Thank you, everyone.
the last hour with us.
You'll receive a recording of this presentation as well. Have a great weekend.
Thank you all so much.
Thank you.
Bye-bye.